First black female clinical technologist, a subspecialty of nephrology in 1998, and has established the first private nephrology clinic in Ghana, which has been in operation for the past 12 years. That's founder Utingo and Brainwave Medical Services Siphokazi Feke. Well, Feke was part of the Yabasadi in 4IR incubation program, which aims to scale 12 women-owned and led enterprises by leveraging technological innovations as well as provide business, technical and financial support. She joins us now to tell us more about her participation. Ms. Feke, very good morning to you. Thank you so much for joining us and a warm welcome to Morning Live.
Thank you. Good morning, and thank you for having me.
Now, first of all, give us some background into where it all started for you, career-wise.
Career-wise, I qualified as a clinical technologist in 1998 and specialized in nephrology. And that ushered me into a space where, as a first black female, it was lacking in diversity, both for gender and also for race. That led me to leave the profession 3 years later because the environment was just not welcoming, was just not a space you want a young black female South African to be able to thrive in. And I went back to business school, and I then took up the business side of healthcare as my chosen profession. I spent about 10 years there, and then in 2009, I quit my day job to establish my own company, which is Brainwave Medical Group.
In simpler terms, Siphokazi, what is a clinical technologist? What do you do? And the field of nephrology, what is it?
Okay, clinical technologist, we are a supporting specialty where we support specialist physicians. We are on the where technology meets clinical medicine. It has got about subspecialties, of which nephrology, which is kidney disease management, is one of them. There's several of them. You'll find perfusion, which is open heart surgery, where the technology that keeps the patient alive is managed by a clinical technologist while the surgeons actually are undertaking the operation. Same with neuro, they are involved in the neurological diagnostic tests that allows the neurosurgeon and the neurologist to be able to have a diagnosis. Okay. So there's got about six specialties, and I specialize in nephrology, which is kidney disease management. Mm-hmm.
And you are known as the CEO and the founder of Brainwave Medical Services, and you are a clinical technologist yourself. How and why did the idea of Utingo come about?
Yes, when we enrolled in the program, they were looking at existing businesses that already have a track record, but they are looking to scale. And what the program does, it takes you through various components of design thinking, which is how to develop solutions with the end customer as your priority, instead of telling the market what it needs. Teaches you how to learn what the market needs and then work that back to a product that you will develop. Yes. So when I enrolled as CEO of Brainwave Medical Group, which is a healthcare company. And the product that we were doing at the time, when it came to a stage of market immersion and testing if the market would receive it, it bombed. And we couldn't be able to take it to market, which is what this program also allows you to be able to fail quickly and quickly get up and and look what is it that's next that you need to do to grow your business. It is at the back of that that Utingo Mobile Technologies was born, because my experience in corporate had taught me how to look into adjacent markets. So when the healthcare product bombed, when it went to market test, then we looked at the market, adjacent market, which was the market for burials. At a time where there's a lot of job losses because of COVID, the mutual burial schemes are the last safety net that as South Africans we have for a decent burial, something that is very core to us as Africans, because we take death as a rite of passage. So it's sacred that how your funeral is done in a dignified manner, whether you have money or you don't. So the fact that people could not be able to go and do their manual payments at the time because there was COVID shutdown, but they could go to grocery stores was the first aha moment. And then taking it back to class on the program where they would teach us business process management, where they would say, okay, we are taking what you have as a quarter business and we are teaching you how to make it into a McDonald's by introducing systems that are backed by science to ensure that it can be successful. Then at the back of that, then we launched a digital platform that allows the funeral homes and the burial societies that run independent schemes to be able to receive their manual payment, their payments that they currently receive manually, to receive them through a retail platform. That reduces the risk of money handling on their part. Mm-hmm. It reduces the cost of having so many branches because that cost of real estate impacts their business profitability. And it also introduces convenience for their customers. So taking my learning, the training that we got from the program, we're able then to launch in an adjacent market from health, which is a life market, to burials, which is a death market.
Now, Siphokazi, tell us briefly about your project with Yabasadi and how that is helping you with boosting Utingo's offering to the public.
What it has helped, I would say it has helped me as the jockey to be able to have more horses to ride, which is what investors mostly would look at when they're looking at scaling companies. They would invest behind the person, which is the jockey that is behind the business. Mm-hmm. So I got into the program as a CEO of a healthcare company. I'm coming out of the program and the portfolio of the companies that I've invested in has grown. And the learnings that have come through the program have not only benefited me on the burial scheme product only, they've also benefited me on the healthcare program. That now we are able to develop a digital solution for medical tourism, which is how we had started initially. That is going to be deployed early next year in ECOWAS, with Ghana as the medical tourism destination within the ECOWAS region of Africa.
Yeah. Let's now talk about the funeral services payment automation system that you are working on with Tumologong and how it will benefit the community.
The platform, what it does is that it gives convenience for the end user, that when they're actually doing their groceries, they can be able to pay for their masingcwabane, at the retail store. Okay. But then it's a B2B with a C benefit. So it's a business-to-business platform. But then the customer, it becomes the end beneficiary. On the business side, they benefit from reduced cost of running their business, because now with geolocators, they can know that this person who paid, this is where they are based. They can reduce their cost of running by not having a lot of real estate cost, by having several branches that are close to each other. They're able to reduce the costs associated with money handling, which they get targeted for robberies towards the month end, when they know that they'll be handling a lot of cash in their premises. So it benefits both the business and the end user, which is the customer. Okay.
It's so heartwarming seeing, a black female having come up with such innovative solutions. I mean, you have worked both in South Africa and Ghana and most parts of the continent. So in your view, what's the role of African female entrepreneurs that they are playing currently and should be playing in coming up with solutions for African problems?
The reality is that, when you empower an entrepreneur that is female, the benefits are not only on the economic development, you also get the social development component of it, which as a continent we need greatly. Studies have proven that when you have female entrepreneurs, they look beyond themselves, and it taps into the nurturing ability of women, that they're able to translate that if I do well, then let me be able to check if my neighbor is also doing well, which you don't find in the other gender. So the role of African women in entrepreneurship, cannot be understated. What we need is more resources, more access, so that we can be able to do this at a broader scale.
And how can African female entrepreneurs then take advantage of organizations such as Tsimologong to assist with technological innovations that can actually help with scaling their businesses?
Organizations like Tsimologong, what they're doing is very critical, which is access to resource. And this is what, as female entrepreneurs, we lack. That you want to do something, but you don't know how to go about it. You want to do something, but you don't know who you need to link up with to be able to bring that to the fore. So organizations like Tsimologong, I encourage female entrepreneurs to look at hubs, tech hubs that allow you to be included in the thought process, that allow you to be included and supported in terms of accessing funding, in terms of accessing networks that would be able to grow your business to the next level.
Okay. Siphokazi, lovely chatting to you. Thank you so much for joining. I mean, you're such an innovative woman who has ventured into so many avenues. So what's next for you? Because nothing seems to be stopping you.
I'm currently in Accra, where we are opening another clinic next week.
Wow.
After we had opened the third largest teaching hospital, we did for them a kidney disease management center of expertise that was commissioned by our ambassador to Ghana, Her Excellency Grace Mason, together with His Majesty the King of the Ashanti. So at the back of that, we're opening now several clinics within Ghana and in South Africa. In South Africa, we've got facilities in Pietermaritzburg, and we're expanding within the KZN area. Hopefully that will be able to go national.
All right, Siphokazi, you are such an epitome of Black innovative excellence. Thank you so much for joining us.
Thank you for having me.
Siphokazi Feke is the founder of Utingo and Brainwave Medical Services. She was part of the Yabasadi in 4IR incubation program, which is a year-long incubation program that aims to scale 12 women-owned and led enterprises by leveraging technological innovations as well as providing business, technical and financial support.